Hello, so for my DISC guide assessment and screening tools, I am going to attach the actual a Word document that I have been working on, and it's going to have all the links that you can click to, so you can just download it and save it if you'd like to. And I'll just go through what I have on here. You will not see it on my screen as I'm talking about it because I am doing this on my phone, but it is on my computer, so it is going to be something that you're going to get the download on when you at the bottom of this video. So the first one, we have the autism spectrum disorder. We have the modified checklist for autism in toddlers, and that's from the early detection in toddlers from the ages of 16 to 30 months. We have a few, and then I also have the social responsive scale, and then an autism diagnostic observation schedule. So all of these have got a link to Autism Speaks, and then it has got the diagnostic tools on that. The next one is going to be trauma and PTSD. The assessment tool that they use in here is PTSD checklist, and this is the DSM-5 self-reported measure for PTSD symptoms, which I thought is pretty interesting. And then they also have, right underneath that, I have the clinician administered PTSD scale for the DSM-5. Okay, so you're going to have both. And then there's a trauma screening questionnaire. So all of those have got the link, which is going to be to the ptsd.va.gov professional assessment adults. Okay, so it is all one link, but it has all the different types of screening tools that are on there. And all these screening tools that I'm giving you have got all the information that you need and how it's going to be added up and all of that. And then there is the generalized anxiety disorder screening tool. And this one, I have two on here. I have the generalized anxiety disorder, which is a 7-item scale. And then I also have the Beck anxiety inventory, which is an assessment which tells us of the presence and severity of anxiety symptoms. And I have the links to go with that. And then the first major MDD, we have the patient health questionnaire, which is the regular PHQ-9, which I think a lot of us are familiar with. And then we have the Beck depression inventory, which also measured cognitive and behavioral aspects of depression. So I thought that was kind of interesting. So links as well to that. Substance abuse, we have the assessment tools. We have the alcohol use disorder identification test, the audit test. And then I have the drug abuse screen test. This is the DAST-10, which identifies drug-related problems. And then I have the CAGE questionnaire. And each one of those has got a link to go with it. So everything is going to have their links at the bottom of it. Okay, pediatric anxiety and depression. The screening tools I've got is for screen for child anxiety related emotional disorders called SCARED. Identifies anxiety symptoms in children. That has a link. And then I have the Children's Depression Inventory, CD1-2, which measures depression in children and adolescents. And that has a link to Child Mind Institute. And all the tools are within that website. The depression, major depression, depressive disorder, alternative tools. We got two going on here. I've got the Jung self-rate depression scale. And this one here assesses the severity of depressive symptoms. And this is a self-written. The nice one about this, the self-written one is that the patients can actually do that for themselves. And then I also have the Hamilton Depression Rating Scale, which evaluates depression severity in the clinical setting. So you can have both. One is for the clinician and the other one is for the patient. And I also have a link to the mental health toolkit. Okay, and then I have the generalized anxiety and alternative tools. We've got the Hamilton Anxiety Rating Scale, which is the clinician administered tool for assessing anxiety with the link. And then I also have the self-rating anxiety scale. Okay, then I have under suicide risk, I've got the assessment tool. I'm using the Columbia Suicide Severity Rating Scale. and it assesses suicide severity. That one has got a link, a PDF link to it. So straight away you click on that one, you're going to be able to get the PDF version, and then you can take it from there. And then the Beck scale for suicide ideations. This measures intensity of suicide intent. This one also is a direct link to a PDF version. And then I have a link to suicide prevention resources. The self-injurious behavior, the assessment tool is the function assessment of self-mutilation. This one, I have two. I also have the self-injurious thoughts and behaviors interview, a comprehensive assessment of self-harm behaviors. I have a link to the official government website for the National Institute of Mental Health. Self-injury, once you get into that website, it has the different ones. This one is kind of a little tricky because you have to make sure you take off blockers on your browser before you get it, because it kind of has like blocks on it. So I couldn't get the actual link to the PDF because you have to, it is restricted, kind of like, I think they don't want you to leave any information on your computer unless you specifically want that. And then I have the dementia, under dementia assessment tool, I have the mini mental state exam, which is the evaluation of cognitive impairment. And that one gives you straight the PDF version. And then I've got the Montreal Cognitive Assessment one as well, which is detects mild cognitive impairments, which is kind of different. And then I have a link to Alzheimer's Association. Interpersonal violence, domestic violence, abuse, the screening tools. I have two. I have the hurt, insult, threaten, scream. It's called HITS. A brief screening for interpersonal partner violence in health settings. There's a link to that, which can help you calculate that and give you the score. And then there's also a danger assessment tool, which evaluates risk for domestic violence lethality. And that is also a web-based. And then I have a link to the National Domestic Violence Hotline. Thank you so much, and I hope you will find these useful. Thank you.